Defining a substance use disorder. Substance use disorders are complicated. Each case is unique, and everyone's experience is varied and personal. There tends to be a basic sequence of steps that unfold, however, from use to problematic use to dependence, that is a very common factor in what otherwise are very individualized experiences. The latest data shows 1 in 12 adults have a substance use disorder. When we speak of substance use disorders, or SUDs, the term substance itself is used to represent one of many possible mind-altering chemical compounds. When one or more of these chemical compounds is used inappropriately, the effects can be detrimental to one's mental and physical health, behavior, and relationships. SUDs exist on a continuum, with the extreme end being what is more commonly referred to as addiction. Specific substances have greater or lesser risks, as well as different time frames associated with the development of physical dependence and/or addiction. Most people are at least somewhat familiar with the dangers of opioids, such as heroin and prescription painkillers. These substances can very quickly lead to dependence or addiction. But they're only one of many potentially addictive chemicals that can cause significant harm when misused or abused. Some of the most common substances of abuse include opioids, cannabis, stimulants, inhalants, hallucinogens, anxiolytics, sedatives, and alcohol. The American Psychiatric Association breaks down substance use disorders into 3 levels of severity: mild, moderate, and severe. The APA also defines the disorder as a medical illness, one of habitual use of an intoxicating substance. Once the addiction interferes with daily life activities, the disorder can be scored using 11 different diagnostic criteria to determine the level of the SUD. These criteria can be helpful for those struggling or for their loved ones in trying to identify the presence of an SUD. In a mild SUD, the user meets 2 to 3 of the 11 criteria. In a moderate SUD, 4 to 5, and in a severe SUD, 6 or more.